So it's our first session in 2025. But before moving to the topic of our workshop, I would like to give a very important comment regarding the technical specificities. So our meeting is conducted in two languages, English and Russian. Could you please mute yourselves? That would help immensely. Thanks a lot. So our session today is conducted in two languages, in English and in Russian. You can choose the language that is most comfortable for you to listen to our speaker and our colleagues. So to choose the language, you need to press the globe button at the bottom of your screen, and there you will see English or Russian. So today we are supported by interpreters, simultaneous interpreters. And also you'll see the reminder about how to choose the language in our chat. So now let's move to the topic of our workshop today. I'm very happy that this session is actually taking place today. So we will talk about a very important topic. This is about the learning and education in the field of palliative care. So today we called our session a workshop, and it's not a coincidence because all our participants today will have to actually actively participate in the workshop. You'll also get the homework to do, and we do hope that we will see you again in March because we have our second workshop planned in March. And the next workshop will be on the results of learning in the field of palliative care. So please don't get scared of this plan. Today, together with our distinguished speaker, we planned accordingly. What I mean is, of course, we are taking into account your workload and we really care about your free time. So we won't overwhelm you with this. And we would just like to give you the results of the workshop that will be applicable in practice for you. A couple of words about PASTE. My name is Ira Chernozhukova, and I represent the Foundation for Palliative Care Education. So, shortly, PASTE. It's a charitable foundation that was established in 2017. It was established in the UK, and the foundation supports professionals in the field of palliative care in the Caucasus countries, Central Asia, Eastern Europe, and the Baltic countries. We help to acquire knowledge and exchange professional experience. So now in the Zoom chat, you'll see the link to our website. So we have a special section there, publications, and there you can see and read our articles, materials, as well as the videos and recordings of our webinars. So we publish the news there, and we also have quite an interesting section. It's the interviews with professionals, your colleagues from different countries. So to keep in touch with us, you can also subscribe to our newsletters. So you can do it via our website. And we also have a Telegram chat, a paste. This is for the professionals from the regions that I've already listed. So we continuously update our Telegram channel, and we announce all our events first and foremost in the Telegram chat. So I guess it would be quite also helpful for you to join the chat. And in the Zoom chat now, you'll see the link. This leads to a short Google form, so you need to fill it in. And that's how we'll be able to add you to our professional Telegram chat and introduce you to your colleagues. So for those who have just joined us, I would like to remind you that our meeting and session today is conducted in two languages, Russian or English. So to choose the language, you can use the Zoom function. You should press the globe button. If you press it, then you'll see the choice, either English or Russian. So please choose the language that is most comfortable for you. So today we are supported by simultaneous interpreters. Our names are Anna Akmaeva and Yulia Kuvashova. I would also like to remind you that at any point of time, when you have any questions to our speakers, or maybe you have some technical issues, then you can just write your questions in our Zoom chat, and we will, of course, address those. And now I would like to introduce our speaker, Esmina Kaibkhanova. She's an expert in the development and implementation of educational programs for medical professionals in the field of palliative care. I think it's very important to mention that back in 2020, in the Center for Palliative Care, this is a large center in Moscow, and this is the major center in the city. So at that point of time, in 2020, the training center was established there. And the goal of this training center is to provide for the good level and the equal level of delivering palliative care in all other departments of this center in the city. And so over 5 years of the existence of this training center, 15 unique programs of advanced training was created in palliative care. And almost 3,000 medical professionals got trained in accordance with these advanced training programs from different regions in Russia. So now I'd like to give the floor to our speaker, Esmina, because Esmina, your expertise is very interesting and very helpful for us. So the floor is yours. Irina, thank you. Colleagues, good afternoon. I'm very happy that you could join on Saturday. I'm sorry if you hear any drilling from my side because, well, you know, Saturday morning is the time when they drill and repair in Moscow. I hope it won't disturb you. So today I have my colleague here, Ekaterina Kutuzova. Katya is waving at you. She is the professional in the field of teaching methodology in our center. Together with Katya, we help our doctors, our nurses, and other professionals to pack all their knowledge in our training materials. And Katya will help us today with the practical session. So now I'll share my screen and I'll start the presentation. In just a second. I hope you can see my screen. Yes, we can. Great. So Irina already presented and introduced myself. So a little bit of a background. So our Center of Palliative Care is the institution that unites all the Moscow hospices, 13 hospices in Moscow, and we have 18 mobile teams that give care at home. And so we have 633 beds in our hospitals, and we provide aid to about 11,000 patients at home. So it's quite a large organization. It wasn't always like this because we actually merged the hospices of Moscow in the one unified institution back in 2018. And so, of course, we had to provide for the equal and coordinated standards. That's why we created this Center of Training and Development, and we have a license for training activities. We do everything, give lectures, we also have advanced training programs, and we also describe the algorithms of providing palliative care, because the unified quality standard means unified regulations and rules. Now, we don't only train our teams and employees. The initial goal was actually to train the teams in our contour within our institution. But now we're not limited to this, and now medical professionals from other organizations also join and get trained within our programs. So when we started to discuss with colleagues from PASTE our workshops, the question that I got is quite logical actually: how to start a training program in an organization? Like we are doing this a lot, right? And it's good to understand how to start. And I said, well, you know, maybe we should ask the question whether the training is needed at all, right? Because if we don't know how to start, then maybe we don't need this at all. But of course, I'll explain what I mean here. Why do we need training, professional, advanced training. It's not about universities, science, etc. It's about advanced professional training. We do this training to achieve some specific professional results or to solve some specific problem. For example, now our teams don't do something with the high quality, something is not enough, and we would like to increase this quality, elevate it, or maybe we are missing something and we'd like to introduce some practices. So when we think about the problem and the implementation of something new, we need still to decide, do we know for sure that the training is needed here or not? Quite often it is needed indeed. But when is it needed? Is it the first step, or shall it be the 10th step, for example? Maybe we should do some preparatory work to actually address the problem that we have, right? And also when we implement and introduce something new, if it's new information, of course, we need to explain it, but what else shall we do, right? The changes management is a separate topic, and actually a lot of examples that I'll give you today is connected to training to solve some problem, specific problem. And now you're listening to me, and maybe it seems to you that I say something very obvious. Well, that's true, actually. Those things are very obvious and clear. And when I was preparing for this presentation today, I thought, well, of course, everybody probably understands that if there is a problem in an organization, we should tackle it not only with training, but something else as well. But I decided to talk about this because I keep medical directors coming to me and they say, well, we need training. And then they talk about the problem that cannot be completely solved with training alone. And I'll give you some examples from practice later. So right after the new year, like just imagine first working day, 9 a.m., and we got a call from the deputy head of one of the Moscow hospitals, and they said that they are establishing and opening a new hospice, and we need to train the personnel very fast. And so we have a program for nurses in palliative care. It's a starting one, 4 days, and we also have a program for doctors, curriculum for doctors that lasts a couple of weeks. So we launch the training very fast. Our nurses get trained, and the results of the training are great, actually. So we do understand that the information was new, it was useful. They participated in the trainings, the feedback was great. Everything was very positive. So we did this to achieve the result, which is our goal was to get the personnel that is trained to work in the palliative care, right? And one doctor actually shared that the training was great, but 3 nurses left after this training. Well, actually, it wasn't exactly the case. They didn't leave exactly after the training. And so I analyzed the situation and I asked a couple of colleagues what happened. So this personnel, these teams were transferred from just a regular hospital to the hospice, like palliative care unit. And so they weren't really explained what palliative care means. They were accustomed to just regular practices in a regular hospital. So they weren't ready for so much care. Some hygienic procedures, a lot of washing procedures, also treating pressure ulcers, etc. That was quite a surprise for them. Another problem was that the topic of death uh, wasn't expected to be so traumatic and so problematic for some people. So in our organization, we have a practice when a new employee comes to join. First, this employee should volunteer for a couple of days just to understand what is happening. The next problem was that there wasn't enough equipment, actually, because we during the training showed different pieces of equipment, lifters, multifunctional beds of the latest generation. So they didn't see it, and in the new hospice wasn't equipped enough. And I've actually heard that some people shared that, well, in the center of palliative care, all the equipment was in place, but in the center where this new team was supposed to work, there wasn't enough equipment. So it was like the expectations and reality, right? So they didn't expect what they would face. And so there was also a shortage of staff, of personnel, and that actually meant that they had to conduct some medical things and procedures while talking to the same patients, calming them down, etc. And so that's why it was too overwhelming, and some people left. So the problem wasn't in the training itself, but it was because of the other aspects that weren't thought over well enough. And so a second problem that we could face, this is about the discoordinated team actions. So here, the working task is to prescribe morphine to fight dyspnea. Actually, now we do have some regulations and practices how to do this, but still this is not enough. And we saw that sometimes the dose of morphine at the very beginning was too big, too high, even if the dyspnea wasn't so bad and this huge dose of morphine wasn't really needed. So there weren't any regulations on this exactly, and we understood that we need to, just write some rules how to prescribe morphine in what amounts, etc. And so we developed this algorithm how to act. It wasn't only about morphine; it was about therapy of dyspnea, also including a usage of morphine when other methods didn't help. So we trained the doctors and we analyzed the results. And still, there were some cases when too big volumes and amounts of morphine were prescribed. So it's quite an interesting case, and there's an interesting detail. So, what were the reasons, right? Some people just weren't attentive enough and they didn't control the new practices. But one doctor shared with me, she said she prescribes like 2.5 milliliters of morphine, the low starting dose. And my nurse tells me, well, doctor, now for this, to inject this, we need to get the insulin syringe, right? Then to write the uh, morphine that is left off. In the past, like we used 5 milliliters vials or 10 milliliters, etc. Well, let's just stick to the old practices because this small practice of very small amounts of morphine will not help the patient in any case. So this doctor shared this, and this doctor told the nurse that no, you should do what I prescribed to do, which is the low dose of morphine. But there is a hypothesis that yes, indeed, some doctors can actually prescribe still bigger volumes of morphines. So the gist is we worked with the doctors, right? But this small detail of working with nurses wasn't taken into account. And so this problem, if it was a large scale, then we should have worked on this problem with the nurses to explain all of this. So this is not a very common example, but it's quite interesting one, right? When a small detail, one element in the chain, if it breaks, then the whole mechanism will not work as a whole. So the next case, it's about the concept that everything should come in time. So the goal was to implement in the work of the nurses some slide sheets. Maybe you know about those. Those are slide sheets that help to transport not mobile patients. So we trained the teams from different departments. There was the chief nurse of the team participating. The results were fine and the training was successful. And now we take a look at the result in practice, right? So it turned out that in some departments, in a couple of months, these slide sheets are not used. They're just lying somewhere and nobody uses them. What could be the reason? There could be multiple reasons, but I'll give you one. So the procurement of the slide sheets was protracted. It took too long. So we trained the personnel and we thought, oh, they go to their work tomorrow and they already can use the slide sheets. But the procurement got protracted, and when actually the personnel got these new slide sheets, they forgot how to use those, and they just abandoned this practice because they just forgot how to do this. And so the results of the learning were actually lost. We had to train them again. So this happened because the procurement and training weren't coordinated, and we didn't ask whether the slide sheets were there or not.
And we didn't take into account the two aspects of the problem. And I will also give you some examples on how we acted before providing the training. The head of the department asked to provide a training on the oxygen concentrators. We can provide small portable oxygen concentrators even for patients at home. So we do have them, and they are to be prescribed. But the problem is that physicians cannot use them. But what is the working problem actually? And she tells me, well, doctors do not know how to use them, and this is the reason why they do not prescribe them. So we do have oxygen concentrators that's in stock, but patients do not use them. So I started to dive into the problem, and the training would not solve this problem actually. Why? Because the reason of the problem was different. It seems to us that it was quite easy to use the oxygen concentrators, but well, there are numerous patients that do need them. For example, a patient wants to go to the forest to pick up mushrooms or to spend some time at dacha. So he would use the oxygen concentrators easily. But well, it turned out that there is no possibility to use them because the doctors opted for not prescribing them to patients. So we need to understand the priorities and to provide the regulation and to train the personnel according to the regulation how to use the concentrator. And there is another example when we decided not to provide the education, the training, because we didn't take into account an important detail. So what was it actually? The head of the department came to us and told us that they needed special training for call centers workers. But these call center workers do not give clear answers. We have listened to how they had been working, and actually they do not introduce themselves. They are not quite eager to help. They're not quite polite enough. They just give an answer, but they were not quite attentive. They do not know how to speak to the patients. They do not know how to introduce themselves. So there is no algorithm, and they are not trained to use the algorithm. And in this case, we said no. We decided to take some time because there are very important elements of this working problem which cannot be solved thanks to training, and the training will be useless. It turned out that there is no systematic control of the quality of the work of the call center workers. There is no feedback on the calls of the workers, and the call center workers know that their work is not under control. So if he or she is lucky enough, his call will not be listened to, would not be studied. So what was important, empathy and the eagerness to help. And if the problem is not solved thanks to the work of the call center worker, the administrator would say just, well, sorry, we couldn't help you. So what is important here is empathy and communication skills. They should be assessed during the recruitment process. So the people who are eager to work as a call center worker should be selected on this basis. So the people working in the HR department who recruit call center workers should pay specific attention to this, to empathy and communication skills. So it means that the selection was not assured during the recruitment. So our answer to the colleagues was as follows. Well, we are eager to help, but if you do not control the call center workers that you have recruited, well, the training that we could provide would be useless. So I have provided you some examples on how to make the treatment a success. Well, you need to collect the anamnesis, treat in a good way, in a right way, and only in this case it would be a success. And actually the same is true for problem solving. You should diagnose the problem. You should take a holistic approach to treat it, and only in this case the training would be successful. Irina, could you please turn off the mic because we can hear you actually. So you know the situation shown in the picture quite well. Actually, it is the roof that should be repaired. You do not need to take as many buckets as possible to solve the problem. So we will train to solve problems that are real problems using the examples from the practical examples. So we will try to formulate problems and diagnose the problem, trying to find out its reasons, its causes. During the first workshop and during the second workshop, we'll try to define very clearly who should be trained and what exactly should be taught. So I will give you some examples from our practice on how we try to solve our problems. And then I will provide you with cases that you will try to solve on your own. So the first question is this problem familiar to you? The problem is like this. Physicians and nurses do not have enough knowledge on how to diagnose and treat bed sores. Could you please leave some comments in the chat, in the discussion? Tamara has said yes. Irina has put a plus. Well, actually, it's a tricky question because It is actually not a problem because if there is a surgery unit, actually this unit can treat the problem. It is not a problem per se. What is the problem? Have, having ensured the inspection of a unit, we have found out that while the bed sore is the problem for this or that patient, there is no positive dynamics. But well, the problem for the unit is different. We have a big procurement department, and it's said that we wouldn't be able to form the budget easily because we have no idea of how the material would be used, because we have almost the same patients in all the units, but still in some units this type of dressing is more used. In another unit, a different another type of dressing is used more, and actually we cannot even explain why this happens like this. And then there is also the problem of using more money than needed, because it turns out that in all the units we have provided the same type of dressings, and some units tell us, well, we actually need more dressings like this. And in another unit, we find out that they have used all dressings of this type, and they need another type of dressing more. So this is actually the problem of procurement. This is a financial problem that we have faced. This is something that we could measure. So because we saw the numbers, the figures, so it was quite clear. Then the second step in our algorithm is to understand the causes of the problem. It was quite difficult to plan the procurement, and the reasons were like this. While there was no unified standard for treating the bed sores, there is the high standard in the country, but it is not quite detailed. Then the second reason is that the personnel didn't quite know how to use the dressings. In one inpatient care facility, this type of dressing is used, but the dressings are changed 2 times a day, and it is more than needed. And in another inpatient care facility, everything is done in a as needed. And then the third reason is that there was no control system how to understand if there are enough dressings, or there is a lack of dressings in this or that unit or care facility. And it is important to understand that the reason is not a hypothesis, it is not an opinion. We need to validate them, we need to explain them, stipulate them. We cannot just say that well, a training is needed. We need to stipulate why the training is needed. We need to find out the figures. We need to understand that this is not just our speculation, but it is a real reason of the problem. And quite often the reasons are quite superficial. We need to dive deeper. And I think you know quite well this method, which implies asking the question why. So we ask the question why, and we try to give an answer. So we try to find out the roots of the problem. I called it a cascade method. So even if you ask this question why 2 times, you will find out the roots of the problem. So, for example, we ask why do the people not have enough knowledge? And it turns out that we use different dressings of different trademarks that change quite often, and us can come up and say, well, actually, I know how to use them, but I cannot memorize the different dressings that we have. Uh, what is the reason of the problem? Well, actually, it's because we organize tenders depending on the price of the dressing. So due to economic and political reasons, the supplies of dressings change. So we turned to Chinese suppliers instead of European ones. So how can we take into account this problem? I will show that to you now. So we can have several root problems. But we have to look at the problems that we can address, that we can take into account. And the step 3 is to plan how to solve the problem. If we understand the reason of the problem, if we understand the roots of the problem, it will be easier to solve it. So the reason was the lack of a uniform standard, and we tried to implement the standard in different units. And we have made a booklet on this. There was another reason, which was the lack of knowledge, which was due to different trademarks used. What was the solution? So to develop a unified local standard or algorithm and implement it in the work of the staff, especially senior staff. And then develop a training program based on the standard and train department managers and staff to work to the standard. And when developing the standard in a training program, emphasis should be put on the classification of dressings by function and mechanism of action. So actually, different types of dressings can be used. And as soon as a new trademark arrives, and I should understand what function this new dressing has. And so he or she will understand easily how that dressing will be applied. And then an accessible knowledge base of dressing classifications and key recommendations should be created. And in Telegram, we created the database on different dressings. It's a little prompt to be used. When it comes to writing off system, well, it's quite complicated, but we have the uniform medical information and analytical system, which can be consulted easily. So you have seen what steps we have been taken using the example of procuring dressings for dealing with the problem of bed sores. And I would ask you to do the same on your own. So step number 1, step number 2 are to be dealt with in the first place. Pain relief problem, actually, it's quite acute for different regions, but the reasons of this problem are different. Irina will tell you how to divide into different groups. So you will need to formulate a problem related to the pain relief in your country or organization and come up with the reasons, the causes of the problem. So the palliative patients receiving care at home often call an ambulance because the therapy prescribed by a doctor does not help them. That is, patients do not receive a quality care and the state spends money on ambulance trips.
So what is the cause? Sometimes the therapy is not proper, not right. That's why patients have to call an ambulance. Also, maybe the baseline therapy was prescribed properly, but the breakthrough pain therapy wasn't prescribed. And one of another very common reasons is that patients do not take their medications in line with their regimen. Now, I'm talking about opioids, or maybe they don't take the prescribed opioids at all. So now you'll have to work in your groups and tackle these issues. So, colleagues, I see that our breakout rooms have closed. So I see that participants are coming back to us. Right. Actually, I also visited a couple of breakout rooms. So first, uh, I understood that not everybody was clear about the template. Actually, it's a small thing because one can also do it without the template. But still, I understand that it requires more time to understand what to write, where to write, to fill in, etc. So actually, Esmina, I wanted to suggest if maybe template wasn't very clear to everybody, we can just, share one of the templates, the problem passports, and we can fill it in together. Well, actually, I think we'll do it in our second part, but I'll just share what I've heard. It was very interesting for me. So, why I chose the topic of pain relief, right? A couple of years ago, me and my colleagues, I mean the lecturers of our training center, participate in PACE conference. It was online, and we were talking about pain relief there. So we talked about different dosage forms of the medicines, how to prescribe those, etc. So I think that, well, the topic of pain relief is the one that is needed for everybody, right? It's very pressing and topical. So we actually got an interesting conversation with our colleagues from Latvia about their problem. Their problem is that there is a number of medicines that are registered in Latvia, right? But you need still to purchase them and order them from another country, if I got you right. For example, you need to buy these medicines in Estonia or somewhere else because, well, still there are almost no stock of these medicines in Latvia because the market is small, number of patients is small, opioids are not required and needed by everybody, right? So, for example, fentanyl, right, in small dosages. Well, this one is difficult to get. I mean, you need to wait to get it. And so, as I said, the market is small, so there is no procurement of this medicine. This is one of the main reasons. And actually, colleagues already shared one of the possible solutions. There is a pharmacy, and they agreed with this pharmacy that this pharmacy will purchase some small amount of this medicine, not to keep patients waiting for too long. But now still, it's a manual management, right? Manual problem solving. So now it's all about like personal agreements. There should be a person who will do this, etc. And maybe if there is another employee in the same pharmacy tomorrow, maybe this employee will not like or will not want to buy this. So if we go into the root cause of this problem, like small market, something else, right? It's just an exercise. So in this situation, the pain relief training is not really relevant until we get the problem that can be solved with the training.
So if we train the colleagues, I mean, not me exactly, but the lecturers, the colleagues, we should have taken into account that some forms of medications cannot be that easily accessible. So, and we should say that if the medication is not accessible, you should use the medication that you already have. So you can use the dressings, the bandages that you have now. If I understand you right, well, it's quite an interesting detail. Thank you for that. Then there was another reason. The problem is that physicians do not prescribe opiates because they are afraid to prescribe them. This is quite a common reason. Actually, it's because the physicians have opiate phobia. This is not the problem that was raised in Latvia, but it was the problem of another country. Maybe some of you would like to share your problem. Colleagues from Armenia or Uzbekistan, please feel free. You can just say your problem. If not, it's fine as well. I can see Tamara.
Да-да.
The point is, I'm the senior nurse of the palliative care unit. Before that, I was the senior nurse of a big medical institution um, where more than 65,000 people worked. It was me who gave the prescription forms for home care patients. I understood why we didn't prescribe weak opiates or opiates to be used at home, especially for the first time. Actually, it was because of training. Physicians who would be physicians are not aware of the scales of pain. They are not aware of what medications they could apply. And another problem is that a patient gets the palliative patient status quite late. And in our region, the palliative status is like a stigma because if he has this status, it will be very difficult for him or her to get another treatment, chemotherapy, for example, because everyone will tell him, well, what do you need actually? You are a palliative care patient. And in this case, people do not think that this palliative care patient could actually live a good life for quite long enough. Thank you, Tamara. It is actually another problem of palliative care. It's not very related to pain relief, but you said that that the problem is that weak opioids are not prescribed for home care patients, and you think that physicians do not have the knowledge needed on how to diagnose the problem and how to treat the problem. And actually, you made the second step, the step two. It is actually the lack of the problem, the lack of the knowledge, and the roots of this problem is that at universities, people are not trained well enough. So what is the solution? Well, actually, we need to change the curriculum at universities. Well, actually, 4-year students get the knowledge, but get this knowledge, but this is not. It is not deep enough, or they have so many things to work on that they forget about it quite easily. Well, by and large, the problem is the lack of knowledge. Training is needed, obviously, but I would try to find out other root reasons, root causes. It's not just the lack of knowledge. It can be something else, the lack of motivation, for example, a fear of prescribing the medication like this. In Russia, for example, 10 years ago, I would say, people were afraid of ampoules because they were afraid of they were afraid of imprisonment, actually, because it's this part of profession life is under the criminal code. So the people were afraid of losing ampoules. And physicians found a way out. They decided not to prescribe opiates. And in Latvia, well, the problem is different, as we have seen. So it's indeed an ad hoc approach. And now I would propose you to make step 2 and try to find out the roots of the problem. Can you see my screen? No. Okay. Can you see it now?
В полный экран надо только перевести.
Full screen, please. Well, we have a real problem. Patients call ambulance very, very often. And the reason for this is that patients do not receive the necessary treatment. Why is it like this? There may be two sub-reasons. We can ask why many times, actually. Well, the first reason is the lack of knowledge among physicians. Well, because a physician, for example, he or she used to be a gynecologist, and then he decided to move to palliative care, so he doesn't have enough knowledge. The second reason is insufficient quality control of prescribed therapy by physicians. There are not enough case-by-case studies, for example. For example, in a case when a patient dies, well, physicians do not make a case study regularly in case of death because they are afraid afraid of the result. Or, for example, if we say that physicians do not prescribe breakthrough pain, in this case, a morphine injection will be needed. Well, why? In some cases, this requirement hasn't been formulated. Physicians had no idea this should have been made. And the third reason, most common one, is that patients are not taking medication according to the regimen, or they're not taking medication at all. Why? Maybe because the recommendations were not provided in detail by a physician, for example. So he hasn't provided enough information. And the second reason, that is quite possible as well, is that the patients have the phobia, opioid phobia. It is either the case for a patient or for the family of a patient or for a physician. And family actually influences patients. Family is afraid of drugs, for example, and the family advises not to take opioids. So these can be the key reasons of the problem. You can probably dig deeper and ask yourself this question: why are the physicians afraid? Is this religion that influences the boss? For example, the chief physician, the head of the department is not for this. Maybe, well, you can come up with your own reason. So we can break into groups once again. Yes, it's quite tricky to break into groups in Zoom. I should say that it's for the first time that PASTE has organized the workshop in this format. So yeah, definitely we will take into account all the technical issues and we'll try to avoid situations like this when a document cannot be opened. I think that was actually the problem related to using a telephone or a computer. Yes, sorry for this, but no, it's not your fault. Next time we will do better. And Rahimov Nawat, the head of hospice from Uzbekistan. Nadir, maybe we have met once in Berlin at a conference. No. Nadir, could you please share with us your problem related to pain relief?
Так, у меня тут такое. Первое — это вот опиатофобия.
So my first one is opioid phobia. Does
И
it
то, и
come from
другое.
doctors or patients? Both.
Причина это
So this is the cause, right? But what is the
проблема это
problem?
чисто
That people don't
наш местный
administer it.
менталитет.
Well, it's our mindset, local mindset. No, but what is the problem? Like patients don't administer enough opioids,
Так,
maybe they don't get it or they suffer from pain. What is the
давайте
problem
начнем с
exactly?
того, что
When?
у
Let's
нас вот,
start
не
with the
знаю,
following.
откуда-то
I don't
у
know
всех у
where it
врачей в
comes
голове
from,
мысль
but
больше трех
all
раз
doctors
наркотики,
have this
наркотики
idea in
нельзя.
mind that
Вот,
more
я
than
тоже
three
был,
doses of
у меня
drugs
тоже были такие
uh,
мысли, я
are
не знаю, где мы это нас учили
can't be really
или когда
administered
это нас
into
учили.
one
И
patient,
когда
right?
стал
I
руководителем
don't really
хосписа, и
remember
3 раза
when we
в
were
день
told this,
максимально,
but for
это
some reason we
оказалось
have this
неэффективно.
concept that
Вот,
not
а теперь,
more than three
опять-таки, у нас
injections of
паллиативной
drugs
помощи
per
как
day
таковой
for a
еще пока
patient.
только
It's not
формируется
efficient.
по всей
Now,
стране.
still, the palliative
Вот,
care
со
is
случайностью
being
до врачей
developed
это
in our
отдельная тема,
country, and
что можно до
it's
10
actually
раз, например, максимум
difficult, really,
сработать.
to convince
Вот.
doctors
Это первое.
of
Второе,
something else. That, for
это
example, you
менталитет со
can
стороны наших
inject
больных,
morphine
что вот,
10
мол, они
times a
станут
day, right?
наркоманами,
And another
будут ломки,
idea is
200
that our
знаете, это
patients
морфина,
will
не
just
знаю,
become
домой
drug
будет ходить
addicts,
людям.
right? And they will have the withdrawals, etc. And so if they don't get morphine at some
Вот.
point of time, they'll just be, like real drug addicts. Okay, so they're
Да,
afraid of
да.
addiction
И
in
это первое.
patients. Yes,
Второе,
correct.
а, у нас
Second
религия
one,
и исламская
we have
религия.
Islam, right?
И вот там
And
написано, что человек
it
не должен
says
пить
there
мед.
that a person shouldn't
Вот,
get
а когда
drunk.
хотим мы того или
And
нет, мы колем
whether we
морфин,
want it or not,
вот,
when we inject
у
morphine,
человека начинается
still
иногда,
the
бывать
person, a patient,
делирки
can
разного
experience some
рода.
hallucinations of
И
different nature.
опять-таки, я же говорю, учитывая наш
And as I've
менталитет,
said, taking into
говорят,
account
это
our
нельзя.
mindset, people say, yeah, this
Вот
is not
такое вот
allowed.
приблизительная
So
картина. И
this
вот
is the
уже второй год
overview. This is
функционирует
the
наш
situation.
хоспис.
And our
Вот,
hospice has
достучаться
been
вот до
working
родственника,
for two
достучаться до самого
years, and it's
больного,
really difficult
донести
to
эту информацию, что
communicate
вот,
this
мол,
information to
извини
doctors
меня,
and patients. It's
мы боремся
difficult
с
to
твоей
convince
болью.
them that,
Вот
we
они
are
могут
fighting
с
your
криками
pain, right? It's
«ах» и
pain
«ох»
relief for you
орать,
because they can be
получить обычный морфин
screaming and shouting for
не
hours,
могут.
for days,
Потому что кто-то
and they don't
опять-таки
want to
ему
get
внушили,
morphine
что
because
ты
somebody
попадешь в
told
пьяном
them
виде
that, well,
в ад и так далее и тому
you will
подобное.
get so-called drunk, like it's a
Вот
substance
такая вот
use,
ситуация у нас
etc.
в Устье.
So that's quite interesting
И
situation.
проблема.
Right, it's quite a problem. Indeed, indeed. Right, so patients don't get opioids because both doctors and patients are biased against opioids, right? And so doctors are afraid to prescribe opioids
Это вот
if they're
больше трех
afraid
раз
of drug addiction in patients,
положено,
right? So more
потому
than
что
three
потом будут
injections of
проблемы
opioids,
юридического
it's
характера.
not
Вот
allowed
откуда эти
because this will
знания? У меня
result
тоже были
in some
аналогичные
legal
мнения,
issues.
знания.
I don't really
Правда, я
know
в таком
where
понимаю,
it
что
comes
где-то
from.
все-таки
I
написано.
got the same
Но
education,
вот с
and
института нам
I've
внушали вот такое
never
вот
seen
понятие.
any legislation like this. But for some reason, starting from the university, we're instilled this idea. Yes, it's quite interesting. You said that there is a myth that
Да,
is not grounded anywhere. Like you
да.
looked for
Вот
some explanation or some legal framework. So there is
Совсем
no legal
недавно,
framework, but
правда,
everybody
я не
believes
помните,
in
чтобы
this myth.
было
Correct,
морфина
yes.
свыше трех
So I
раз
haven't seen anywhere
нельзя.
in any official
Ни в
documents that
учебниках,
one cannot
но
administer
такой вот
morphine more
правильно
than three
выпустили миф
times per
у
day.
всех
Right, but we have this
в
myth, right,
голове.
in
Я
our
говорю, а может 4,
minds.
5, 6
Actually, I've heard it like
руководителей
from
хосписа,
about six
напиши
doctors,
немедленно.
and they say, yeah, like you're the head, so if you allow us to do this, then we will administer more than three
Да.
times. Yes, so that's what the doctors are saying. Okay, just out of my interest,
М,
for example, you allow
Да.
to inject more than three times
Нет.
morphine, right? And then
Нет.
they do it,
Ага.
and like nothing happens. I
Но,
mean, no drug addiction,
понимаете,
etc., no dire
это
consequences.
надо
And then this doesn't
биться.
help other doctors
Сейчас
do
вот так
believe that it's
работаем над
fine,
этим,
right? Well, we
делаем
are working on this
методическую,
now, and now
методическое
we are also
а,
working with the
исправление
legal specificities, right? So we draft and change our roadmap to avoid any questions and misunderstanding from lawyers and doctors, etc. Right, I got it. But as to the legal framework, it's still being developed, right? Because our hospice has been working for only 2 years, so it's still under development. Right. It's very interesting what you shared, and I'll share with other colleagues. Actually, Ira, I think it's time for other colleagues to come back because we planned 10 minutes for this exercise. Right, and this time is coming to an end. So let's probably give less time to the last exercise, right? Yes, actually, we can just present, introduce the exercise, and my colleagues, I mean, the participants can also just do it at home. I'll just explain the main details. Right, so our colleagues got back from breakout rooms. I'll share what we discussed with Nadir. Nadir is from Samarkand, from Uzbekistan. And Nadir shared very interesting problem. The problem is patients do not get enough pain relief. And this is the problem in the hospice or at the level of the country, right? It's because of the opioid phobia in both patients and doctors. And so these are the main obstacles. It's interesting that you didn't mention some problems like there are no all dosage forms of opioid medicines. Right, in Uzbekistan, we use promidol, morphine, amnarpon, and now we can also give morphine in pills. We got approval for this. Right, so morphine in pills is quite a convenient dosage form. It's interesting that Nadir didn't mention this problem as a problem, but the main issue for them is the opioid phobia. And another interesting cause that he's mentioned, well, doctors believe that opioids can be administered not more than 3 times per day. So this is what they are taught at universities. And actually, the colleague, Nadir, couldn't find any ground, any explanation, any document that says so, right? So it's kind of a myth that is just traveling, around Uzbekistan. And doctors are afraid of administering morphine more often than 3 times a day, or maybe in bigger dosages. It's interesting, Right, so it's not grounded anywhere. And what I also expected is that, and actually, yes, I expected it, and it indeed was voiced. Opioid phobia is connected to religion, right? Because, well, in Islam, no substances are allowed. And so patients and, as far as I understand, doctors have this idea that they will commit a sin, so it's not in line with their religion. And I guess that's one of the serious problems and issues in Islamic countries, because we can continuously train doctors pain relief, and they will understand better how medicines work and why it's better to administer those in patients. But still, it's very difficult to overcome this bias. And well, maybe it's even can be interpreted differently. I mean, in terms of religion, right? Because, well, um, Quran, the main Muslim text, has never prohibited curing, right? Right. Actually, we also do research together with people from the religious sphere, together with those people who interpret the religious texts. And we working on actually asking these people maybe to give their opinion. Maybe it's not prohibited at all. Right. So actually, opioid phobia can be connected to the legal framework and criminal offense, right? Because, well, if we even train doctors and they're afraid because of the legal framework, we need to change the legal framework first. But I guess in case of Uzbekistan, this work with the religious community that interprets religious texts is the tool how to address this problem, because we need to show doctors that opioids are not equal to committing sins in terms of substance use. So the problem solution doesn't depend only on training, but also depends on the work across different aspects. And Nadir mentioned another very important and interesting thing. So Nadir said that doctors do not administer opioids because there are side effects in the form of some hallucinations, some cloudy mind, etc., if I heard you correctly. And this is actually a cause that can be addressed with training, because there is a therapy how to prevent side effects from using opioids. And this could actually help to avoid the problem that Nadir mentioned. So if doctors don't know how to prevent those side effects, that means that patients might get some side effects and experience some hallucinations, for example. And well, the effect and the result is that indeed there is opioid phobia and morphine phobia. So maybe we should also focus on training doctors how to prevent those side effects. It's just one of the suggestions. Right, Nadir, thank you very much. Actually, you indeed introduced some analytical approach towards solving a problem, and it's indeed very important when one makes decision on training, right? So on what to train, what to do, and if you indeed are going into training, you need to identify the knowledge gap. So, step three, task three, exercise three. We do understand the problem. We do understand now its root cause. Now we need to develop mechanisms how to address it. What do we need? Training. If training is indeed needed, then we need to understand what to train people in. What needs to be done on top of the training? And I'll just present you our case. So, as I said, our problem was patients calling ambulance quite often because of the pain relief. One of the reasons is incorrect home therapy because of the lack of knowledge in doctors and insufficient quality control. So the solution here would be first to train doctors to identify their knowledge gap, and second, also to continuously discuss cases with doctors and analyze mistakes. Now we do analytics actually. What patients call the ambulance too often? We analyze what medicines they got as a prescription. Then we analyze why these medicines didn't help, why the ambulance was still called, and then we analyze it all together with doctors, and the doctors understand what were the causes of this. And this is also training for us as well as the control measure for us. So the second cause in the same problem was that patients were not administering their medicines in accordance with the regime or regiment and regimen, or they do not really understand how to do this, right? What can be the solution here? We can train doctors how to prescribe medicines. I mean, what kind of explanation is needed? We also tell doctors that it's very important to explain to the patient that they should not wait until they get the pain, right? These medicines have the accumulating effect, right? They should be administered in line with the regimen. And also, there are some tips for doctors. For example, do not forget to explain to the patient your recommendations, right? To draw the patient's attention to the most important things. And it's about the lack of communication, right? Why is this lack there? Well, maybe doctors don't understand that it's very important to communicate everything to the patients very clearly, very simply and transparently. Maybe they don't know how to explain it in easy language, right? And then we can come up with some scripts, texts, phrases that they can use, train doctors how to explain medicines to patients in simple words. It's just an example, right? In reality, there can be some other solutions. And cause number three for us, why patients were calling ambulance for pain relief. Well, because doctors can even administer, prescribe the opioids, but patients are afraid of taking those and they just don't take any pain relief. So if we only train doctors in pain relief, then this cause, this problem will not be solved. So in this cause number three, we need to train doctors in how to respond to patients' questions, how to work with patients' fears, right? Because patients can ask, will I become a drug addict? Or if you prescribe morphine, does this mean that I'm dying or something else, right? So if we see the phobia from patients coming, then the doctor needs to answer the questions. And even if the patient doesn't ask any questions, but the doctor sees that the patient is afraid of opioids, then the doctor should proactively explain all this. Okay, so imagine we train doctors on how to communicate to patients about this, right? And so we continue to tell doctors that they really need to explain to patients all this. The second solution here, and we are already doing this, we need to develop some materials like workshops, videos, brochures, maybe some presentations, etc. We communicate this information to the patients' communities. We tell when opioids can be prescribed, why it's not so scary, how to fight with this fear. And in our training programs, we have a separate module that is called Communicating about Difficult Issues, Difficult Topics. And we explain how to talk to patients about this and how to answer difficult questions. So, Irina, will we give some time to our colleagues to search for solutions to their problems now, or will we turn it into their homework, like independent work, and I will finalize our theoretical part
Нет,
now?
смотри, я так понимаю,
So,
что это по сути в том числе входит
I guess,
в часть
Ismina,
домашнего
that
задания.
the task
Мгм.
number three
Может
is
быть,
also part of
у меня
our
просто есть
homework,
немножко ощущение,
right? I
что
just,
мы все
I get a
устали.
feeling that we got a little bit
Да,
tired.
я понимаю, что это на самом
Yes,
деле
it's quite
такая,
a difficult thing to
ну,
do, right?
много сложных вопросов и
Right,
сложных
there are a
проблем
lot of
одновременно,
difficult
да, озвучивается,
questions
и
and
действительно как будто бы
problems,
хочется в
and it
спокойном
feels
режиме, вот
like
туда вглубь
some more time
уходить,
is needed.
поразмыслить. Поэтому,
That
если
10
тебе
minutes will not
удобнее, мы
be
можем переходить
enough.
к
So if it's okay
инструкциям
for
по
you,
домашнему
we
заданию.
can now
И,
introduce our
соответственно,
homework.
да, конечно.
Yes, and I would also like to give some final part of my presentation. I understand what Ira is saying, and I understand that the work that we've just suggested and the topic requires a lot of effort, a lot of intellectual work, right? Probably you don't want to do it on Saturday, but unfortunately, Saturday was the only day when I could do this. We don't understand that training is not a silver bullet, right? But still, to do all this, to analyze all this, to identify the problem, to identify one root cause, another root cause, quite often people just try and tend to skip this stage. And quite often in my work, I hear Well, if there are any mistakes committed, then it's because of the untrained personnel. Well, no, this is not always the case. Nobody wants to go into the training, right? Just one curriculum, one training will not solve all the problems because there can be different causes, the bad schedule, overwhelmed doctors, personnel, but everybody wants to get some silver bullets. So to do this work, to analyze problems is difficult and the topic is not very popular, I guess. But I do believe that without this work, training can be absolutely inefficient, useless. We can do the training and there will be no effect.
So first we need to understand what problem we are trying to solve. Even if we talk about opioid phobia that some physicians have, well, the problem is opioids are not prescribed, and the result, patients do not receive the drugs needed. In Latvia, there is another problem, and opioid phobia is not the problem there. So the first thing is to understand what problem exactly are we trying to solve. Is the training actually needed in this or that organizations? What reasons do we have? Is it only the training that is needed, or maybe there is another thing, as Nadir said, there is religion behind, and if we do not solve this small problem, we wouldn't be able to solve the biggest problem. We need to understand what reason, what cause is the first one. Maybe if we do not try to counter some religious rules or what we understand as religious rules, we wouldn't be able to solve the big problem. Or in Russia, for example, this was the problem related to the criminal code and being criminally liable for the loss of the ampoule or the pill. And as soon as we solved this problem, the opioids started to be prescribed more easily. And then there is the problem of side effects, for example, and the prescription of morphine and so on. And if it's a big team of doctors or physicians, we should prioritize and say that this physician does this, this physician does that. This is actually what I wanted to say to you. If it is useful for you, for your organization, for the unit where you work, I would be happy. Our center has several channels, have several groups in Telegram, and you can join them if you want. We are not rivals with PASTE, so please feel free. We have some prompts for physicians, for medical nurses dealing with palliative care. And the homework, if you want to dig deeper in the problems that your organization has, please find a problem that is quite acute for your unit, your organization, or your country. Then please make a passport of this problem. If you have some questions, please feel free to join me via WhatsApp. And till the end of this month, please send the passport of the problem to the PASTE email, and then please join us during the workshop that will take place on the 29th of March. During this workshop, we will find out who need to be trained and what need to be taught. And by the end of March, we will have all your problems at hand, so it will be easier to communicate. I have my personal group on the education on training in medicine, please join it if you want. I would like to thank the organizers and the interpreters and the participants as well. Thank you very much. Esmina, could I say a couple of words as well? We were talking about opioid phobia, and I tried to remember what solutions we have found during the lectures. We found out that new physicians worked with the experienced ones who had prescribed morphine, and they saw that it helped actually to the patient, and the patient was quite okay. He or she was conscious, and it was quite good because actually the experience of your colleagues could help the new ones. Obviously, for the first time, it's quite complicated to prescribe the medication like opioids for the first time, especially if it is prescribed to a home care patient. But if it is happening in the medical facility, when you are close to more experienced doctors, it is better, it is easier. Then there are obviously some people who have a standing and who can influence on how people think. And in the Far East, there was a case like this. Promidol was prescribed together with morphine, and it was not quite correct. And in this situation, we should work with these people who have the standing, who have who can influence on how people think and how people act, what medication they prescribe. And I would also like to add that together with Esmina, what result we can see when we speak about problems and the causes. After lectures like this, we can see that people can see that the training was useful. It was the practical approach that was applied. So nurses see that this is a case-to-case study, actually. Yes, thank you, Ekaterina. It was indeed like this. The training should be useful. It should be useful both for the heads of hospices or palliative care centers and for the workers, for those people who work in the centers. The training should follow the hands-on approach. And colleagues, at some point I haven't posed the question to you. Maybe you want to take the floor, and I will give the floor now to Ira. She's a moderator, and she will give you this opportunity. So yes, colleagues, please, if you have some questions that you would like to ask Esmina or Ekaterina, this is the time. But when it comes to organization, to materials, to the presentation, I will be able to answer them in our WhatsApp chat. But first of all, please, if some of you have questions, please turn on your mics and pose the question.
Да, конечно, Надир.
Nadir, please,
Как-нибудь в ближайшее время организуйте
could you please
по
organize
более обусловленные нейропатические боли.
a workshop on
Нейропатические боли. Потому что
neuropathic
нервно-сенситивную боль
pain,
спокойно помогаем.
because
Если
well, we have morphine
допустим,
to treat
вот проблема с нейропатической
other
болью
types of pain.
в нашей стране
But when it comes to neuropathic pain, it is more complicated. Please take it into account.
Давай ты сначала, потом я.
Well, it's not about webinar exactly, but neuropathic pain is something that we have been dealing with now. I have given you a link to the databases. It's a typical group in Telegram, and you will find information about the neuropathic pain. There are even some video lessons about this type of pain. If you want, I can send this information via the organizers. Yeah, yes, it would be great. And organizers will organize a workshop maybe as well. I agree with you, neuropathic pain is something quite particular. It can be mixed with other types of pain as well, so it becomes complicated.
Вам спасибо за озвученные
Thank you,
информации.
Nadir.
Мы обязательно
We
учтем
will
когда
take it
будем
into
составлять план
account
наших обучающих
when
мероприятий. И я бы хотела сделать такой
we
небольшой
will be
вывод
making a
следующему
plan
уроку, потому что
of
если,
workshops.
допустим, там мы или вы
And
найдете
if
специалиста,
you
эксперта, который готов докладывать о
can
нейропатической
find an
боли,
expert
то как раз
who deals with
структурировать
neuropathic
и собрать
pain,
учебный курс или даже
it
просто
would
такую
be
программу
great. We on our side will
обучительное
try to do the
мероприятие,
same to
можно будет, прослушав
make a
следующий
lecture.
воркшоп Эсмины, которая как раз будет рассказывать о том, как
And
сделать
Esmina
и структурировать обучение, когда вы уже
Esmina will
понимаете,
actually
куда мы
give
идем. Вот как вы
some
сейчас
information
сказали, если
on
это
how to
онлайн, на базе
structurize
знаний по
the training.
обезболиванию в случае нейропатической боли.
And we will
По
take a
поводу
separate
полезных
case related
материалов,
to
которые
neuropathic
Эсмина говорила,
pain.
мы обязательно продублируем все QR-коды
All the
и
QR
ссылки
codes will be
на
provided to you.
канал и вот на
Links
специфику
to
использования
the
терминала.
groups in Telegram will be given as
Скажите,
well.
пожалуйста, если сейчас... Да.
Ira, could I give a comment about nutritive support? Well, we have been talking about training. And Nadir, for example, if you are ready to train your personnel on the neuropathic pain, the next workshop within this educational track will be useful to you because the next workshop will be about structurizing the information in lectures or in a training course. The information should be presented in the way that physicians would be able to understand it correctly. So this topic of nutritive support is quite vast, and we have made a course about the nutritive support, about nutritive deficiency. Many things were included actually, and this course was useful to half of our staff because one half works in inpatient care facilities and the other half works in home care. And they didn't prescribe, physicians didn't prescribe the nutritive support for patients in home care, for example. So the point of joining PACE workshop is to get the information that is useful to you. If you or your unit, your organization have the need of in this training. We have, for example, a new decree implying that all physicians that work in home care should evaluate the nutritive status of a patient, and they can prescribe two types of special nutritive mixtures. And what does it mean? If physicians working in inpatient care facilities take this course, well, it will not be useful to them actually. So this should be taken into account. Physicians who work with home care patients will find this workshop useful, on the contrary. So actually, the next workshop will be about how to provide training in a structured manner and how to make it on your own. How the heads of hospices would be able to make on their own. And obviously, experts should be invited. And this is what I will be talking about during the next seminar, a new workshop. And you, in your different countries, will be able to adapt the information that I will present. Yes, I would like to add, it would be great if you invited your colleagues to the next workshop. I mean, colleagues who will be dealing with training together with you. Maybe there are other hospices that have not joined us, and it would be great if they did it, because it would be very useful, especially if they are planning to provide a special training. Thank you very much, Nadir, for your question. Colleagues, other questions maybe? I think everyone is eager to spend the Saturday on their own. No, thank you very much. I turned on the mic just to say thank you. Latvia talk about fentanyl, about the problem to get it. I work in an inpatient facility, and we work with adults and children, and I saw a problem there. These dressing is not applied in the right way, actually, especially when a patient is sweating, and it means that this fentanyl dressing doesn't work. So we need to train nurses on how medications should be used correctly. That would be quite interesting, I think. We should work with colleagues and to transmit this message on the correct application. Obviously, it is something that nurses study, but sometimes they forget, and as a result, they do not apply medication correctly. Yes, I agree with you. A patient doesn't receive the pain relief because the dressing wasn't applied correctly. Physicians are trained how to apply the bandages, the dressings, but the nurse doesn't do it correctly. And what does it mean? It means that the problem is not solved. So we need to think about the reasons, about the causes like this. Sometimes it is this detail that counts. You should choose the type of, you should choose a place where to put the dressing. It's a very good example. Thank you. It is quite a nerdy job, actually, but we need to do it. If you work in a small unit, you can see how it works, and you see all the small mistakes that are made. But if it's a big facility, we should get down to a table and analyze all the mistakes and problems that exist.
Да, Гундага, большое
Thank you
спасибо
very
за
much,
этот
Gundiga.
совет.
It was a pleasure to see
Смотрите,
you once
давайте
again.
я резюмирую,
Well,
потому
I
что
will sum it up.
из-за технически сложных маршрутов, мне кажется, у некоторых
I think
из наших
that
участников были вопросы,
some of
и
the
не все было,
participants
может быть, понятно, поэтому
had
давайте я
questions,
коротко резюмирую.
so I will sum it up briefly.
Мы вас сейчас приглашаем
Now we
в
invite you
WhatsApp-чат
to the
сообщение
WhatsApp
вы
discussion,
видите
to
в
WhatsApp
чате вот
chat,
здесь, вот
and
посреди трансляции в Zoom.
you can
Там
see
есть ссылка на WhatsApp-чат.
the message
Туда
in
мы
the chat of the
перешлем
Zoom conference.
все
We will
шаблоны
send all the templates that
для работы над той проблемой,
for
которую вы для
working
себя выберете,
on the
и в
problem that you
качестве
will choose.
разбора на домашнем задании. Во-вторых, мы
So
туда
you'll get all the
перешлем
templates for your homework. Also, we will
Эсмины, где,
share
как правильно
Esmina's
заметил
slides
кто-то
and
из участников,
presentation.
все по
And
полочкам,
as
по
one of the
порядку
participants already mentioned,
разложено, и мне
it's
кажется,
very well
что
structured,
в какой-то более
very
спокойной
clear. And
обстановке,
I
когда мы не
think
будем
that
ограничены во
after
времени, будет
the
полезно еще
webinar,
раз по ней
workshop,
пройтись, и тогда,
when you're not limited in time,
мне
it
кажется,
would be quite useful
правда,
if you could go through the
любая
presentation
проблема,
once
которая
again.
возникает,
And so
вот мы
basically, any
обсуждаем вопрос, какие у
problem
нас есть проблемы в
that
паллиативной
you
помощи,
might
она сразу
get
будет
in palliative
раскладываться вот
care
этим вот
might
поощрением
be and can be
и работа
structured
будет идти
and
по-человечески.
analyzed
Также
based
мы
on
туда
this method.
или хотя бы
Uh,
двух.
based of the method over three why questions or at
Также
least
мы
two
туда
whys,
перешлем
right?
анонс
Also, we'll share the
следующего
announcement
нашего
about
нашего
our
воркшопа.
next workshop.
Это все мы сделаем
We will
в
do
ближайшие
all
дни, в
this
начале следующей недели
shortly.
в рабочие
I
дни.
mean, in the
И
beginning of the
я надеюсь, что у
next
нас
week,
получится
working week.
сделать
I hope
монтаж
that we'll also
сегодняшней
be able
трансляции,
to
да, чтобы у вас также, кому не может быть не очень удобно это видеть в
prepare
презентации, нет времени почитать, но
the
будет
video
возможность послушать и
from
посмотреть.
today's workshop and
Все
share it
будет
later with you.
обязательно в этом
Maybe
чате
it'll be more
появляться.
convenient for you just
Все
to once
материалы,
again
которые
watch the
Эсмина
video instead of
упоминала, мы
reading
также
the
туда
materials.
продублируем.
Everything that was
Мне
mentioned
кажется,
today will
что
also be
собирается очень
included
полезный
in
источник,
our
поэтому мы вас
materials
призываем
after this session.
присоединиться.
I think that
Эсмина,
altogether
на
it's quite
всякий
a
случай
useful
дайте
source of information. So please
запомнить
join our
домашнее задание
chat.
до 1
So our
марта
homework
по тем
should be done
шаблонам, над которыми
before
мы
the
сегодня
1st
работали или
of
не
March.
получилось открыть,
And you should
но
use the
сейчас это уже не
templates
важно.
that
Будет
we
возможность доступа даже
showed you
как-то в
today
чате.
and that you already
Вы
tried to work with
собираете
today.
ту
Everything will be
проблему,
in
над которой
chat.
хотите работать,
So
и
you will
на втором
work
воркшопе
on
Эсмина
one
сможет
problem,
уделить
right? And during our second
этим примерам,
workshop,
кто пришлет домашнее задание,
Esmina
больше
will be
внимания. То есть
able to comment on your
это будет самый, что ни
homework.
на есть
So
прикладной
this
разбор,
will be
который
very practice
поможет вам
oriented
организовать
analysis and
обучение
it will
по той
help you
проблеме,
to
которую вы
maybe
проработали на
organize
домашнем
some
задании.
training on the problem that you chose as a homework. Right. So passport is about the diagnostics of the problem, right? And if colleagues share their problem passports, then I am actually ready to give feedback before our next webinar, because our next webinar will be on the topic of training itself. And if we need to finalize the problem analysis, we can do it before the next workshop. We can do it like via emails or texts or even have a call. And if we have enough problem passports for the next webinar, we'll just take a problem out of those and we'll analyze the training section and we'll discuss it and work on this. But if we don't get enough homeworks and home assignments, then we'll just give more theory. But I'm ready to consult on your problem passports on an individual basis, because the passport of the problem is not only about
Коллеги, мне
training.
кажется, это отличная
Okay,
возможность. У
colleagues,
нас
I think
есть
that's a great opportunity.
как бы канал прямой, да, с экспертом посоветоваться.
You have
Поэтому мы
the
вас
direct
призываем
channel, direct communication channel with our
воспользоваться этим
experts. So
магазин
we
симпозий
invite
также
you
в
to
чате.
join this work. All the
Тогда
instructions will be published in our
дедлайн
chat.
1 марта,
So the
и
deadline is
все
1st of
паспорты,
March,
все
and the
документы, которые будут
documents
как раз присланы в
that
этот чат, мы
are
передадим
sent
Эсмине, и она
before the
их
1st of
подготовит
March,
вам
we'll
обратную
transfer
связь.
all these documents to
Да?
Esmina, and she will analyze it and give her feedback. I have another comment
Это все,
here.
да. Да.
There was a request for QR codes to our channels.
Мы сделаем и
So
QR-коды,
we'll
и ссылки,
arrange
потому что,
all
да, это не
this.
всегда
We'll
удобно
share
с телефона
links
все
and
уходит,
QR
собственно,
codes,
с телефона действительно.
etc.
А, Коллеги,
Okay,
да, большое
colleagues,
спасибо.
thank you.
Большое спасибо команде
Thank you
Paste,
very
большое
much to
спасибо нашим
Paste team.
сегодняшним
Thank you very
переводчикам,
much to our interpreters
которые помогали
that worked for
сделать
you today and tried
наш
to
воркшоп
help to
максимально
make this
доступным, Анне
workshop
Акмаевой
as
и Юлии Кувашовой. Я
available
еще раз
and
хочу
clear as
напомнить, что
possible.
для того,
Today, Anna
чтобы
Akmaeva and Yulia Kovashova
следить
were
за всеми
working for
нашими
you.
анонсами и
So,
мероприятиями, в
to
том числе по темам, которые сегодня были озвучены,
be
по
in the
наиболее
loop
интересным,
about
мы уже
our
постараемся
announcements,
придумать
our events, to
какой-то
know
формат
when
работы
we will
и
organize what.
обучений.
We're also coming up
А,
with new formats of our
Сейчас в
trainings.
чате
You
появятся
can
ссылки на все наши странички в соцсетях,
monitor
и
our pages
вы также
on
можете
social media.
подписаться
Now you can see
и,
all the links in our chat,
соответственно, увидеть
and
анонсы
you can see
наших
the
мероприятий. И
announcements of
напоминаю, что
our
у нас
events
есть
in these
чат
channels. I'd
в
like to remind you that
телеграм-канале,
we
к
have a
которому вы
Telegram
можете
chat.
присоединиться.
You can join it
А, Ссылку на него на Google
by
форме,
filling
которую
in
вы
a Google
увидите
form.
сейчас в
And
чате.
now you will see the Google form
По
link
завершению этого
in our
вебинара у вас
chat.
откроется вкладка
So
с
after this workshop,
формой обратной связи.
you'll
Очень
see
прошу вас ее
the
игнорировать.
page with
Нам
the
важно
feedback.
понимать, где у нас
Please fill it in. Do not
что-то
ignore it. It's very
получилось
important for us to
отлично, а с
understand
чем-то мы
what we
трудности у вас как у
succeeded in
слушателей,
and
чтобы в
what was
следующий раз мы
difficult for
могли
you
это
today
поправить.
as our participants. Next
И
time, we'll make
таким
it even
образом улучшить
better.
качество
And
наших
so we'll make the
мероприятий.
quality
Ну что ж,
of the
коллеги, до новых
workshops and
встреч.
webinars
Спасибо
even
вам большое за
higher.
внимание.
Thank you very much, and I'll see you
Спасибо, до
soon.
свидания.
Thank you. As the background of Irina says, love always wins. See you.